Hey guys, Curtis Alexander. I'm a pharmacist. In this video, I'll be talking about using Feverfew to treat and prevent migraines. At the end of the video, I'll kind of give you my general recommendation, but in this, I'm going to go over the studies, feedback I've gotten from patients, dosing, those sorts of things. First, the studies. One of the studies I wanted to talk about, there were 72 people, 72 volunteers in the study. It was placebo controlled, so they were comparing it against a group that wasn't getting feverfew, and that's good. They treated these folks for roughly 4 months, and at the end of that time, they did find that it decreased the number of attacks, how bad the attacks were. It also showed a decrease in the amount of vomiting that people experienced when they had their migraines. What it did not show, it showed no effect on the duration of the migraines. Okay, the next study involved 147 patients, also placebo controlled, so that was good. It did show overall benefits similar to the first study. However, it was kind of only in a subgroup. That is, it showed benefit in people who experienced more than 4 migraines per month before they started the study. So if you're somebody who gets 2 or 3 migraines a month, may not be that effective for you, but it was in people who experienced more than 4 a month. And then finally, there was a smaller study, 24 patients. The thing I liked about this study, it was very reflective of the type of people we see with migraines, which is primarily women 19 to 61 years of age. And what they found, they gave them daily dosing of Feverfew. They did it for 60 days. They did see in 8 of those patients, they experienced a significant reduction in their migraines. Another 5 patient experienced reductions. It was less significant. So that's roughly half of these people, slightly more than half, that did experience a reduction in their migraines. And again, that's in a really critical patient population for migraines. So the biggest takeaway from the studies, can Feverfew help with preventing migraines? Yeah, it does appear to be fairly effective, also fairly safe. As far as treating migraines, I'll get questions on, can it treat it? No evidence to support that it can treat it. So meaning, if you're feeling migraine coming on and you want to take Feverfew, can it help in an acute setting? Doesn't appear to. It's more of a prevention thing, something you'd have to take every day. Speaking of taking it every day, what dose are we looking at? In the studies, there was a range, but I would generally say 50 to 150 milligrams a day of Feverfew in powder form, whether that's capsules, what have you. You can do that daily. They did it up to 4 months in the studies. It appeared to be pretty safe, so I would probably start there. There is a product out that's a carbon dioxide extract. One of the studies used that. I don't think you have to get that. I'll provide a link to these in the description if you want to look at the products. But if you went with that carbon dioxide extract, they use 2.08 to 18.75 milligrams 3 times a day, again for 3 to 4 months. In most cases, though, you can just stick with the general Feverfew powder. Okay. One thing I want you to watch out for is drug interactions. Feverfew can have interactions with prescription drugs and supplements. So talk to your pharmacist. If you do it, have them run an interaction check with what you're taking right now. The biggest concern we have, if you're taking anything that's anticoagulant, blood thinners, aspirin, warfarin, Eliquis, those sorts of things, you're going to want to be very careful about that because it can make that situation worse. So bottom line is it good? Yeah, I think it's worth a shot. It appears to be pretty effective in most people. Like I said earlier, I would, if you only get a couple of migraines a month, I don't know if it's going to help you. But if it's more than that, I think it's worth a shot. It appears to be good as a preventing migraines. And, I think overall it's definitely worth a shot. Definitely check for those drug interactions. So that's something you want to keep an eye out for. Let me know in the comments if you've used Feverfew, if it was helpful, not helpful for migraines. I really appreciate it getting your guys' feedback in the comments. And I know other people that watch the video find it helpful as well. So I hope this video was helpful, guys. I'll see you in the next one.